Public Law 116 to 22 116th Congress. Title 3, Reaching All Communities SEC. 301. Strengthening and assessing the emergency response workforce. A. National Disaster Medical System. 1. Strengthening the National Disaster Medical System. Clause 2 of Section 2812 A. 3A, 42 U.S.C. 300 HH 11A, 3A, is amended to read as follows: (2) Be present at locations, and for limited periods of time, specified by the Secretary on the basis that the Secretary has determined that a location is at risk of a public health emergency during the time specified, or there is a significant potential for a public health emergency. 2. Review of the National Disaster Medical System, Section 2812b, 2, 42 U.S.C. 300 HH 11b, 2, is amended to read as follows: (2) Joint Review and Medical Surge Capacity Strategic Plan, (A) review. Not later than 180 days after the date of enactment of the Pandemic and All Hazards Preparedness and Advancing Innovation Act of 2019, the Secretary, in coordination with the Secretary of Homeland Security, the Secretary of Defense, and the Secretary of Veterans Affairs, shall conduct a joint review of the National Disaster Medical System. Such review shall include, (I) an evaluation of medical surge capacity, as described in Section 2803A, (2) an assessment of the available workforce of the intermittent disaster response personnel described in subsection C, (3) the capacity of the workforce described in Clause 2, to respond to all hazards, including capacity to simultaneously respond to multiple public health emergencies and the capacity to respond to a nationwide public health emergency. 4. The effectiveness of efforts to recruit, retain, and train such workforce, and V. Gaps that may exist in such workforce and recommendations for addressing such gaps. B. Updates. As part of the National Health Security Strategy under Section 2802, the Secretary shall update the findings from the review under subparagraph A, and provide recommendations to modify the policies of the National Disaster Medical System as necessary. 3. Notification of shortage. Section 2812C, 42 U.S.C. 300 HH 11C, is amended by adding at the end the following: (3) Notification. Not later than 30 days after the date on which the Secretary determines the number of intermittent disaster response personnel of the National Disaster Medical System is insufficient to address a public health emergency or potential public health emergency, the Secretary shall submit to the Congressional Committees of Jurisdiction a notification detailing, (a) the impact such shortage could have on meeting public health needs and emergency medical personnel needs during a public health emergency, and (b) any identified measures to address such shortage. 4. Certain appointments. (a) In general. If the Secretary determines that the number of intermittent disaster response personnel within the National Disaster Medical System under this section is insufficient to address a public health emergency or potential public health emergency, the Secretary may appoint candidates directly to personnel positions for intermittent disaster response within such system. The Secretary shall provide updates on the number of vacant or unfilled positions within such system to the Congressional Committees of Jurisdiction each quarter for which this authority is in effect. B. Sunset. The authority under this paragraph shall expire on September 30, 2021. 4. Authorization of appropriations. Section 2812G, 42 U.S.C. 300 HH 11G, is amended by striking $52,700,000 for each of fiscal years 2014 through 2018 and inserting $57,400,000 for each of fiscal years 2019 through 2023. B. Volunteer Medical Reserve Corps. 1. in general. Section 2813a, 42 U.S.C. 300 HH 15a, is amended by striking the second sentence and inserting the Secretary may appoint a director to head the Corps and oversee the activities of the Corps chapters that exist at the state, local, tribal, and territorial levels. 2. Authorization of appropriations. Section 2813I, 42 U.S.C. 300 HH 15I, is amended by striking 2014 through 2018 and inserting 2019 through 2023 C. Strengthening the Epidemic Intelligence Service. Section 317F, 42 U.S.C. Sec. 247b7, is amended, 1, in subsection A, in paragraph 1I, by inserting all preparedness and response activities, including rapid response to public health emergencies and significant public health threats after conduct prevention activities, and 2, by striking $35,000 and inserting $50,000, and b, in paragraph 2b, by striking 3 years and inserting 2 years, and 2, in subsection c, a, by striking for the purpose of carrying out this section and inserting the following, 1, in general. For the purpose of carrying out this section, except as described in paragraph 2 and b, by adding at the end the following, 2, Epidemic Intelligence Service Program. For purposes of carrying out this section with respect to qualified health professionals serving in the Epidemic Intelligence Service, as authorized under Section 317G, there is authorized to be appropriated $1,000. for each of fiscal years 2019 through 2023. D. Service benefit for National Disaster Medical System volunteers. 1. In general. Section 2812C, 42 U.S.C. 300 HH 11C, as amended by subsection 3, is further amended by adding at the end the following, 5. Service benefit. Individuals appointed to serve under this subsection shall be considered eligible for benefits under Part 50 of Title I of the Omnibus Crime Control and Safe Streets Act of 1968. The Secretary shall provide notification to any eligible individual of any effect such designation may have on other benefits for which such individual is eligible, including benefits from private entities. 2. Public Safety Officer Benefits. Section 1204(9) of Title I of the Omnibus Crime Control and Safe Streets Act of 1968, 34 U.S.C. 10284(9), is amended, a, in subparagraph C2, by striking or at the end, b, in subparagraph d, by striking the period and inserting apostrophe, or, and, c, by inserting after subparagraph d, the following, E, an individual appointed to the National Disaster Medical System under Section 2812 of the Public Health Service Act, 42 U.S.C. 300 HH 11, who is performing official duties of the Department of Health and Human Services, if those official duties are, I, related to responding to a public health emergency or potential public health emergency, or other activities for which the Secretary of Health and Human Services has activated such National Disaster Medical System, and 2, determined by the Secretary of Health and Human Services to be hazardous. 3. Sunset. The amendments made by paragraphs 1 and 2 shall cease to have force or effect on October 1, 2021. E. Mission Readiness Report to Congress. 1. Report. Not later than 1 year after the date of enactment of this section, the Comptroller General of the United States, referred to in this subsection as the Comptroller General, shall submit to the Committee on Health, Education, Labor, and Pensions of the Senate and the Committee on Energy and Commerce of the House of Representatives, a report on the medical surge capacity of the United States in the event of a public health emergency, including the capacity and capability of the current healthcare workforce to prepare for, and respond to, the full range of public health emergencies or potential public health emergencies, and recommendations to address any gaps identified in such workforce. 2. Contents. The Controller General shall include in the report under paragraph 1a, the number of healthcare providers who have volunteered to provide healthcare services during a public health emergency, including members of the National Disaster Medical System, the Disaster Medical Assistant Teams, the Medical Reserve Corps, and other volunteer healthcare professionals in the verification network pursuant to Section 319I of the Public Health Service Act, 42 U.S.C. 247 D7b. B. The capacity of the workforce described in subparagraph A, to respond to a public health emergency or potential public health emergency, including the capacity to respond to multiple concurrent public health emergencies and the capacity to respond to a nationwide public health emergency. C. The preparedness and response capabilities and mission readiness of the workforce described in subparagraph A, taking into account areas of healthcare expertise and considerations for at-risk individuals, as defined in Section 2802b, 4b, of the Public Health Service Act, 42 U.S.C. 300HH1b, 4b. D. An assessment of the effectiveness of efforts to recruit, retain, and train such workforce, and E. Identification of gaps that may exist in such workforce and recommendations for addressing such gaps, the extent to which the Assistant Secretary for Preparedness and Response plans to address such gaps, and any recommendations from the Controller General to address such gaps. SCC 302. Health System Infrastructure to improve preparedness and response. A. Coordination of preparedness. Section 2811b. 5, 42 U.S.C. 300HH10b, 5, is amended by adding at the end the following: such logistical support shall include working with other relevant federal, state, local, tribal, and territorial public health officials and private sector entities to identify the critical infrastructure assets, systems, and networks needed for the proper functioning of the healthcare and public health sectors that need to be maintained through any emergency or disaster, including entities capable of assisting with, responding to, and mitigating the effect of a public health emergency, including a public health emergency determined by the Secretary pursuant to Section 319A, or an emergency or major disaster declared by the President under the Robert T. Stafford Disaster Relief and Emergency Assistance Act or the National Emergencies Act, including by establishing methods to exchange critical information and deliver products consumed or used to preserve, protect, or sustain life, health, or safety, and sharing of specialized expertise. B. Manufacturing capacity. Section 2811d, 2c, 42 U.S.C. 300HH10d, 2c, is amended by inserting apostrophe, and ancillary medical supplies to assist with the utilization of such countermeasures or products, after products. C. Evaluation of barriers to rapid delivery of medical countermeasures. 1. Rapid Delivery Study. The Assistant Secretary for Preparedness and Response may conduct a study on issues that have the potential to adversely affect the handling and rapid delivery of medical countermeasures to individuals during public health emergencies occurring in the United States. 2. Notice to Congress. Not later than 9 months after the date of the enactment of this Act, the Assistant Secretary for Preparedness and Response shall notify the Committee on Energy and Commerce of the House of Representatives and the Committee on Health, Education, Labor, and Pensions of the Senate if the Assistant Secretary for Preparedness and Response does not plan to conduct the study under paragraph 1, and shall provide such committees a summary explanation for such decision. 3. Report to Congress. Not later than 1 year after the Assistant Secretary for Preparedness and Response conducts the study under paragraph 1, such Assistant Secretary shall submit a report to the Committee on Energy and Commerce of the House of Representatives and the Committee on Health, Education, Labor, and Pensions of the Senate containing the findings of such study. SCC 303 Considerations for at-risk individuals. A. At-risk individuals in the National Health Security Strategy. Section 2802b, 4b, 42 U.S.C. 300 HH1b, 4b, is amended, 1, by striking this section and sections 319c1, 319f, and 319 liters, and inserting this act, apostrophe, and, 2, by striking special and inserting access or functional. B. Countermeasure considerations. Section 319 liters C6, 42 U.S.C. 247 D7 EC6, is amended, 1, by striking elderly and inserting older adults, and, 2, by inserting with relevant characteristics that warrant consideration during the process of researching and developing such countermeasures and products before the period. C. Biosurveillance of emerging public health threats. Section 2814 is amended, 1, in paragraph 7, by striking apostrophe, and inserting a semicolon. 2, in paragraph 8, by striking the period and inserting apostrophe, and, 3, by adding at the end the following, apostrophe 9, facilitate coordination to ensure that, in implementing the Situational Awareness and Biosurveillance Network under Section 319D, the Secretary considers incorporating data and information from federal, state, local, tribal, and territorial public health officials and entities relevant to detecting emerging public health threats that may affect at-risk individuals, such as pregnant and postpartum women and infants, including adverse health outcomes of such populations related to such emerging public health threats. SCC 304. Improving emergency preparedness and response considerations for children. Part B of Title 3, 42 U.S.C. 243 et seq., is amended by inserting after Section 319D the following, ZC 319D1. Children's Preparedness Unit. A. Enhancing emergency preparedness for children. The Secretary, acting through the Director of the Centers for Disease Control and Prevention, referred to in this subsection as the Director, shall maintain an internal team of experts, to be known as the Children's Preparedness Unit, referred to in this subsection as the unit, to work collaboratively to provide guidance on the considerations for, and the specific needs of, children before, during, and after public health emergencies. The unit shall inform the Director regarding emergency preparedness and response efforts pertaining to children at the Centers for Disease Control and Prevention. B. Expertise. The team described in subsection A shall include one or more pediatricians, which may be a developmental behavioral pediatrician, and may also include behavioral scientists, child psychologists, epidemiologists, biostatisticians, health communications staff, and individuals with other areas of expertise, as the Secretary determines appropriate. C. Duties. The team described in subsection A may, 1, assist state, local, tribal, and territorial emergency planning and response activities related to children, which may include developing, identifying, and sharing best practices. 2. Provide technical assistance, training, and consultation to federal, state, local, tribal, and territorial public health officials to improve preparedness and response capabilities with respect to the needs of children, including providing such technical assistance, training, and consultation to eligible entities in order to support the achievement of measurable evidence-based benchmarks and objective standards applicable to Sections 319C1 and 319C2. 3. Improve the utilization of methods to incorporate the needs of children in planning for and responding to a public health emergency, including public awareness of such methods. 4. Coordinate with, and improve, public-private partnerships, such as healthcare coalitions pursuant to Sections 319C2 and 319C3, to address gaps and inefficiencies in emergency preparedness and response efforts for children. 5. provide expertise and input during the development of guidance and clinical recommendations to address the needs of children when preparing for, and responding to, public health emergencies, including pursuant to Section 319(c)(3), and (6), carry out other duties related to preparedness and response activities for children, as the Secretary determines appropriate. SCC 305. National Advisory Committees on Disasters. A. Reauthorizing the National Advisory Committee on Children and Disasters. Section 2811A, 42 U.S.C. 300HH10A, is amended, 1, in subsection B2, by inserting mental and behavioral, after medical, 2, in subsection D.A, in paragraph 1, by striking '15' and inserting '25', and B, by striking paragraph 2, and inserting the following. '2, required non-federal members. The Secretary, in consultation with such other heads of federal agencies as may be appropriate, shall appoint to the Advisory Committee under paragraph 1, at least 13 individuals, including A, at least 2 non-federal professionals with expertise in pediatric medical disaster planning, preparedness, response, or recovery, B, at least 2 representatives from state, local, tribal, or territorial agencies with expertise in pediatric disaster planning, preparedness, response, or recovery, C, at least 4 members representing healthcare professionals, which may include members with expertise in pediatric emergency medicine, pediatric trauma, critical care, or surgery, the treatment of pediatric patients affected by chemical, biological, radiological, or nuclear agents, including emerging infectious diseases, pediatric mental or behavioral health related to children affected by a public health emergency, or pediatric primary care, and D, other members as the Secretary determines appropriate, of whom, I, at least 1 such member shall represent a children's hospital, 2, at least 1 such member shall be an individual with expertise in schools or childcare settings, 3, at least 1 such member shall be an individual with expertise in children and youth with special health care needs, and 4, at least 1 such member shall be an individual with expertise in the needs of parents or family caregivers, including the parents or caregivers of children with disabilities. 3. Federal members. The Advisory Committee under paragraph 1 shall include the following federal members or their designees, who may be non-voting members, as determined by the Secretary. A. The Assistant Secretary for Preparedness and Response. B. The Director of the Biomedical Advanced Research and Development Authority. C. The Director of the Centers for Disease Control and Prevention. D. The Commissioner of Food and Drugs. E. The Director of the National Institutes of Health. F. The Assistant Secretary of the Administration for Children and Families. G. The Administrator of the Health Resources and Services Administration. H. The Administrator of the Federal Emergency Management Agency. I. The Administrator of the Administration for Community Living. J. The Secretary of Education. K. Representatives from such federal agencies, such as the Substance Abuse and Mental Health Services Administration and the Department of Homeland Security, as the Secretary determines appropriate to fulfill the duties of the Advisory Committee under subsections B and C. 4. Term of appointment. Each member of the Advisory Committee appointed under paragraph 2 shall serve for a term of 3 years, except that the Secretary may adjust the terms of the Advisory Committee appointees serving on the date of enactment of the Pandemic and All Hazards Preparedness and Advancing Innovation Act of 2019, or appointees who are initially appointed after such date of enactment, in order to provide for a staggered term of appointment for all members. 5. Consecutive appointments. Maximum terms. A member appointed under paragraph 2 may serve not more than 3 terms on the Advisory Committee, and not more than 2 of such terms may be served consecutively. 3. In subsection E, by adding at the end at least 1 meeting per year shall be an in-person meeting. 4. By redesignating subsection F as subsection G. 5. By inserting after subsection E the following F coordination. The Secretary shall coordinate duties and activities authorized under this section in accordance with section 2811d. And 6. In subsection G, as so redesignated, by striking '2018' and inserting '2023' B, authorizing the National Advisory Committee on Seniors and Disasters. Subtitle B of Title 28, 42 U.S.C. 300 HH et sec. Is amended by inserting after section 2811 the following, ZC 2811b National Advisory Committee on Seniors and Disasters A. Establishment. The Secretary, in consultation with the Secretary of Homeland Security and the Secretary of Veterans Affairs, shall establish an advisory committee to be known as the National Advisory Committee on Seniors and Disasters, referred to in this section as the Advisory Committee. B. Duties. The Advisory Committee shall, 1. Provide advice and consultation with respect to the activities carried out pursuant to section 2814, as applicable and appropriate. 2. Evaluate and provide input with respect to the medical and public health needs of seniors related to preparation for, response to, and recovery from all hazards emergencies, and 3. Provide advice and consultation with respect to state emergency preparedness and response activities relating to seniors, including related drills and exercises pursuant to the preparedness goals under section 2802b. C. Additional duties. The Advisory Committee may provide advice and recommendations to the Secretary with respect to seniors and the medical and public health grants and cooperative agreements as applicable to preparedness and response activities under this title and Title 3. D. Membership. 1. In general. The Secretary, in consultation with such other heads of agencies as appropriate, shall appoint not more than 17 members to the Advisory Committee. In appointing such members, the Secretary shall ensure that the total membership of the Advisory Committee is an odd number. 2. Required members. The Advisory Committee shall include federal members or their designees, who may be non-voting members, as determined by the Secretary, and non-federal members, as follows. A. The Assistant Secretary for Preparedness and Response. B. The Director of the Biomedical Advanced Research and Development Authority. C. The Director of the Centers for Disease Control and Prevention. D. The Commissioner of Food and Drugs. E. The Director of the National Institutes of Health. F. The Administrator of the Centers for Medicare and Medicaid Services. G. The Administrator of the Administration for Community Living. H. The Administrator of the Federal Emergency Management Agency. I. The Undersecretary for Health of the Department of Veterans Affairs. J. At least 2 non-federal healthcare professionals with expertise in geriatric medical disaster planning, preparedness, response, or recovery. K. At least 2 representatives of state, local, tribal, or territorial agencies with expertise in geriatric disaster planning, preparedness, response, or recovery. L. Representatives of such other federal agencies, such as the Department of Energy and the Department of Homeland Security, as the Secretary determines necessary to fulfill the duties of the Advisory Committee. E. Meetings. The Advisory Committee shall meet not less frequently than biannually. At least 1 meeting per year shall be an in-person meeting. F. Coordination. The Secretary shall coordinate duties and activities authorized under this section in accordance with section 2811d. G. Sunset. 1. In general. The Advisory Committee shall terminate on September 30, 2023. 2. Extension of committee. Not later than October 1, 2022, the Secretary shall submit to Congress a recommendation on whether the advisory committee should be extended. C. National Advisory Committee on Individuals with Disabilities and Disasters. Subtitle B of Title 28, 42 U.S.C. 300 HH et sec., as amended by subsection B, is further amended by inserting after section 2811 b the following, ZC. 2811C. National Advisory Committee on Individuals with Disabilities and Disasters. A. Establishment. The Secretary, in consultation with the Secretary of Homeland Security, shall establish a National Advisory Committee to be known as the National Advisory Committee on Individuals with Disabilities and Disasters, referred to in this section as the Advisory Committee. B. Duties. The Advisory Committee shall, 1. Provide advice and consultation with respect to activities carried out pursuant to Section 2814, as applicable and appropriate. 2. Evaluate and provide input with respect to the medical, public health, and accessibility needs of individuals with disabilities related to preparation for, response to, and recovery from all hazards emergencies, and 3. Provide advice and consultation with respect to state emergency preparedness and response activities, including related drills and exercises pursuant to the preparedness goals under Section 2802b. C. Membership. 1. In general. The Secretary, in consultation with such other heads of agencies and departments as appropriate, shall appoint not more than 17 members to the Advisory Committee. In appointing such members, the Secretary shall ensure that the total membership of the Advisory Committee is an odd number. 2. Required members. The Advisory Committee shall include federal members or their designees, who may be non-voting members, as determined by the Secretary, and non-federal members, as follows. A. The Assistant Secretary for Preparedness and Response. B. The Administrator of the Administration for Community Living. C. The Director of the Biomedical Advanced Research and Development Authority. D. The Director of the Centers for Disease Control and Prevention. E. The Commissioner of Food and Drugs. F. The Director of the National Institutes of Health. G. The Administrator of the Federal Emergency Management Agency. H. The Chair of the National Council on Disability. I. The Chair of the United States Access Board. J. The Undersecretary for Health of the Department of Veterans Affairs. K. At least 2 non-federal healthcare professionals with expertise in disability accessibility before, during, and after disasters, medical and mass care disaster planning, preparedness, response, or recovery. L. At least 2 representatives from state, local, tribal, or territorial agencies with expertise in disaster planning, preparedness, response, or recovery for individuals with disabilities. M. At least 2 individuals with a disability with expertise in disaster planning, preparedness, response, or recovery for individuals with disabilities. D. Meetings. The Advisory Committee shall meet not less frequently than biannually. At least 1 meeting per year shall be an in-person meeting. E. Disability. Defined. For purposes of this section, the term disability has the meaning given such term in Section 3 of the Americans with Disabilities Act of 1990. F. Coordination. The Secretary shall coordinate duties and activities authorized under this section in accordance with Section 2811d. G. Sunset. 1. In general. The Advisory Committee shall terminate on September 30, 2023. 2. Recommendation. Not later than October 1, 2022. The Secretary shall submit to Congress a recommendation on whether the Advisory Committee should be extended. D. Advisory Committee Coordination. Subtitle B of Title 28, 42 U.S.C. 300 HH et sec., as amended by subsection C, is further amended by inserting after section 2811C the following, ZC. 2811d. Advisory Committee Coordination '(a). In general. The Secretary shall coordinate duties and activities authorized under Sections 2811a, 2811b, and 2811c, and make efforts to reduce unnecessary or duplicative reporting, or unnecessary duplicative meetings and recommendations under such sections, as practicable. Members of the advisory committees authorized under such sections, or their designees, shall annually meet to coordinate any recommendations, as appropriate, that may be similar, duplicative, or overlapping with respect to addressing the needs of children, seniors, and individuals with disabilities during public health emergencies. If such coordination occurs through an in-person meeting, it shall not be considered the required in-person meetings under any of Sections 2811a, 2811be, or 2811cd. (b). Coordination and alignment. The Secretary, acting through the employee designated pursuant to Section 2814, shall align preparedness and response programs or activities to address similar, dual, or overlapping needs of children, seniors, and individuals with disabilities, and any challenges in preparing for and responding to such needs. (c). Notification. The Secretary shall annually notify the congressional committees of jurisdiction regarding the steps taken to coordinate, as appropriate, the recommendations under this section, and provide a summary description of such coordination. SCC 306. Guidance for participation in exercises and drills. Not later than 2 years after the date of enactment of this Act, the Secretary of Health and Human Services shall issue final guidance regarding the ability of personnel funded by programs authorized under this Act, including the amendments made by this Act, to participate in drills and operational exercises related to all hazards, medical and public health preparedness and response. Such drills and operational exercises may include activities that incorporate medical surge capacity planning, medical countermeasure distribution and administration, and preparing for and responding to identified threats for that region. Such personnel may include state, local, tribal, and territorial public health department or agency personnel funded under this Act, including the amendments made by this Act. The Secretary shall consult with the Department of Homeland Security, the Department of Defense, the Department of Veterans Affairs, and other applicable federal departments and agencies as necessary and appropriate in the development of such guidance. The Secretary shall make the guidance available on the Internet website of the Department of Health and Human Services.